The warning sign most people dismiss first may be the one that matters most. It appears during intimacy. You stop for a moment. The feeling fades. And because it faded, you tell yourself everything must be fine. But sometimes the fact that a symptom disappears after you stop is not proof that the danger has passed. It may be the clue that reveals what triggered it. Imagine feeling a strange pressure beneath your breastbone. Not crushing pain, not a dramatic collapse, just pressure. You sit up, breathe slowly, and 2 minutes later it is gone. Most people would feel relieved. A doctor would want to know why it happened. Today we are going through 7 warning signs adults over 60 should never ignore during intimacy. Some are obvious, others are quiet, temporary, or easy to blame on age, anxiety, a heavy meal, or being out of shape. And warning sign number 1 connects all of them, because it explains why relief can sometimes create a false sense of safety. Before we begin, this is not a reason to fear intimacy. For many older adults, intimacy remains a safe and meaningful part of life. People with stable heart disease can often remain sexually active, although anyone recovering from a heart attack, heart procedure, or worsening heart symptoms should ask a healthcare professional when it is safe to resume. This video is educational. It cannot diagnose an individual medical condition. The goal is not to make you suspicious of every faster heartbeat or deeper breath. Those can be normal responses to physical effort. The goal is to recognize a different pattern, something sudden, something severe, something unfamiliar, or something that feels clearly wrong for your body. Many people hide symptoms during intimacy for a deeply human reason. They are not only afraid of what the symptom might mean, they are afraid that admitting it will cause a doctor or partner to take intimacy away from them. But silence does not preserve independence. Recognizing a warning early may help protect it. Warning sign number 7 is chest discomfort that does not feel like the dramatic pain people expect. You are in an intimate moment when something changes. There is a weight in the center of your chest, or a band-like tightness, or a burning sensation that resembles indigestion. You can still talk, so you assume it cannot be serious. Then your jaw feels strange. Perhaps one shoulder begins to ache. You change position and wait. This is where many people make the first dangerous mistake. They ask, "Is the pain unbearable?" That is not the best question. Heart attack symptoms can include pressure, squeezing, fullness, tightness, burning, or discomfort in the center of the chest. The feeling may spread to one or both arms, the shoulders, back, neck, jaw, or stomach. Shortness of breath, nausea, cold sweating, lightheadedness, unusual weakness, or fatigue may also occur. Some people have subtle symptoms. Women, older adults, and people with diabetes may not experience the movie-style chest pain they imagined. So ask a better question. Is this new, unusual, or connected to physical effort? Do not try to finish the moment and see whether it gets worse. Stop. Sit or lie in a safe position. If the discomfort lasts more than a few minutes, goes away and returns, spreads beyond the chest, or comes with breathlessness, sweating, nausea, weakness, or dizziness, call your local emergency number. Even when you are not certain it is a heart attack, emergency professionals would rather evaluate a false alarm than arrive after a dangerous delay. And notice the first piece of our mystery. Heart-related discomfort does not always remain constant. It can ease. It can return. It can create just enough relief to make someone wait. Warning sign number 6 is breathlessness that feels wrong. Breathing naturally becomes faster during intimacy. That alone is not an emergency. The warning is when your breathing feels out of proportion to the activity, arrives suddenly, or does not begin settling when you stop. Picture this from inside the moment. You sit upright because lying back feels uncomfortable. You try to take a full breath, but it feels as if the air stops halfway in. Your partner asks a simple question, and you realize you cannot answer in a complete sentence without pausing. You may be tempted to say, "I am just out of shape." Age can change endurance. It should not be used to explain every new symptom. Normal exertion usually says, "Give me a moment to catch my breath." A warning feels more like, "I cannot get enough air." Sudden shortness of breath can occur with heart problems even when there is no chest discomfort. It may also appear with an abnormal heart rhythm or another urgent condition. Stop immediately if the breathlessness feels severe or unfamiliar. Call emergency services if it is severe, worsening, or accompanied by chest pressure, fainting, confusion, marked weakness, or a rapid, irregular heartbeat. If the episode is milder but keeps appearing during intimacy, brisk walking, climbing stairs, or carrying groceries, arrange a medical evaluation. A repeating pattern matters even when every episode eventually settles. And that is our second clue. The symptom may become quiet when the body rests, while the reason it appeared remains unanswered. Warning sign number 5 is a sudden cold sweat, nausea, dizziness, or the feeling that you may faint. This warning is easy to explain away. The room was warm. You had not eaten enough. You stood too quickly. You became nervous. Any of those explanations may be possible. None should be assumed when several warning signs arrive together during physical effort. Imagine your partner suddenly becoming pale. Their skin feels cold and damp. They say the room is tilting. Their hearing seems distant. Their vision narrows, and they grip the bed because they are afraid they will fall. Then, after lying down, they say, "It is passing." This is not a moment for embarrassment or jokes. Fainting happens when the brain temporarily does not receive enough blood flow. It can have harmless causes, but it can also be connected to a blood pressure problem, an abnormal heart rhythm, or another medical condition. Cold sweating, nausea, and lightheadedness can also appear with a heart attack. If someone loses consciousness during intimacy, call your local emergency number, especially if there is chest discomfort, breathing difficulty, an irregular heartbeat, confusion, weakness, or an injury. If the person is unresponsive and not breathing normally, call immediately and follow the dispatcher's CPR instructions. Even if the person wakes quickly, do not let the quick recovery erase the event. Waking up explains what happened next. It does not explain why consciousness was lost. Here is the emotional trap. Many older adults do not want to frighten their partner, so they minimize the symptom while they are still experiencing it. "I am okay. It was nothing. Please do not call anyone." Those words may come from fear, not from medical certainty. Warning sign number 4 is a heartbeat that feels chaotic rather than simply fast. A faster heartbeat during intimacy is expected. The concern is a sudden rhythm that feels completely different from your normal response. A flutter, a hard thump, a pause, then a rapid series of beats that seem irregular or out of control. Some people describe it as a bird trapped in the chest. Others say the heart feels as though it is flipping, vibrating, skipping, or pounding in the throat. These sensations are often called palpitations. Palpitations can have many causes, and not every episode is dangerous. But the surrounding symptoms change the level of concern. A rapid or irregular heartbeat with chest pressure, severe breathlessness, fainting, near fainting, confusion, or marked weakness requires urgent medical attention. Do not spend several minutes staring at a smartwatch while the person becomes weaker. A device may capture useful information, but it cannot safely rule out an emergency. Do not take an extra dose of heart medicine unless a healthcare professional has already given you a specific plan for that exact situation. If the rhythm settles but the episodes return, record what you can remember. Did it start suddenly? Did it feel regular or irregular? How long did it last? Did it stop abruptly? Was there dizziness, pain, sweating, weakness, or breathlessness? Those details can help a clinician decide what needs to be investigated. And now the pattern changes. Until this point, the warning may have seemed connected to the heart, breathing, or blood pressure. The next one may involve the brain. When it appears, there is no safe waiting period to see whether the mood improves or the person becomes less embarrassed. Warning sign number 3 is any sudden change in the face, arms, speech, vision, balance, or coordination. You are talking to your partner when their words become unclear. They try to smile, but one side of the face does not move normally. They lift both arms, but one begins drifting downward. Or they suddenly cannot understand a simple sentence. Other warning signs can include sudden numbness or weakness, especially on one side of the body, sudden trouble seeing, sudden dizziness, loss of balance, difficulty walking, or a sudden severe headache with no known cause. These can be signs of a stroke. Remember B.E.F.A.S.T. B is balance. Has balance suddenly disappeared? E is eyes. Has vision suddenly changed? F is face. Does one side droop? A is arms. Does one arm drift or feel weak? S is speech. Is it slurred, confused, or unusual? T is time. Call your local emergency number immediately. If you can, note when the symptoms began, or the last time the person was known to be normal, and follow the emergency dispatcher's instructions. Now listen carefully, because this brings us back to the mystery. Stroke-like symptoms can sometimes disappear after a few minutes. That may be a transient ischemic attack, often called a TIA or mini-stroke. Temporary does not mean harmless. At home, you cannot reliably tell whether the event is a TIA or a major stroke in progress. Both require immediate medical evaluation. The face looking normal again does not cancel the droop you saw. Speech returning does not erase the words that became slurred. Relief is not a diagnosis. Warning sign number 2 is unexpected bleeding or sudden, severe, or persistent pain. This warning is different because not every case requires an ambulance, but none should be hidden or normalized. After menopause, hormonal changes can make vaginal tissues thinner, drier, and more sensitive. That can contribute to discomfort or light bleeding from irritation. But any vaginal bleeding after menopause should be checked by a healthcare professional, even if it happens only once, even if it is only spotting, and even if there are no other symptoms. Most causes are not cancer. But because postmenopausal bleeding can sometimes be a sign of a serious condition, guessing at home is not the safe choice. Pain deserves the same honesty. Mild discomfort related to dryness or friction may improve with more time, slower movement, communication, and an appropriate lubricant. Sudden sharp pain is different. Severe pelvic or abdominal pain, uncontrolled bleeding, faintness with bleeding, a serious injury, or sudden severe testicular pain requires urgent assessment. There is also one emergency many men hesitate to mention. An erection that lasts more than 3 to 4 hours requires emergency treatment, especially when painful. Waiting can lead to permanent tissue damage. Do not delay emergency care while trying home remedies. Do not apply ice or drink alcohol. Seek emergency care. The important line is not between embarrassing and not embarrassing. It is between a manageable discomfort and a symptom that is sudden, severe, recurring, persistent, or unexplained. Your healthcare professional has heard these concerns before. Protecting your privacy should never mean protecting a dangerous symptom from medical attention. And now, we reach warning sign number 1, the sign from the beginning, the one that can make a person feel safer precisely when they should become more curious. Warning sign number 1 is a symptom that appears when the body works harder, fades when you stop, and returns during the next period of exertion. It may be chest pressure, jaw or arm discomfort, unusual breathlessness, nausea, a heavy feeling in the upper body, or overwhelming fatigue that arrives during activity and disappears with rest. This pattern can occur with angina, which happens when the heart muscle is not receiving enough oxygen-rich blood. Angina commonly appears during physical activity or stress and may improve quickly with rest. That does not mean every temporary sensation is angina. It means that disappearing is not the same as being explained. Think back over the last several weeks. Did pressure appear during intimacy and fade after you stopped? Did a similar sensation occur while climbing stairs? Did you feel unusually breathless carrying shopping bags? Did your jaw or shoulder ache during a brisk walk and improve when you slowed down? One isolated sensation can be difficult to interpret. A repeating relationship between effort and symptoms is much harder to dismiss. This is the moment when some people conduct a dangerous experiment. They resume the activity to see whether the symptom comes back, or they climb the stairs quickly to test the heart. Do not perform your own stress test. Write down what happened. Where did you feel it? What did it feel like? Did it spread? How long did it last? What were you doing when it began? What made it improve? Has it happened during any other physical activity? Then contact a healthcare professional promptly. If the discomfort is new, severe, worsening, happening with less effort than before, appearing at rest, lasting more than a few minutes, or occurring with sweating, nausea, breathlessness, fainting, or weakness, call emergency services. Now the opening mystery has an answer. Why can a symptom that disappears still be dangerous? Because stopping the activity may remove the demand that exposed the problem. The silence of the symptom does not prove there was no warning. It may tell you exactly when the warning appears. 7 signs can feel like a lot to remember, so reduce the entire video to 3 decisions. Stop, call, check. Stop when a symptom is sudden, severe, unfamiliar, or clearly different from normal exertion. Do not push through it to protect the mood. Do not hide it to avoid worrying your partner. Call your local emergency number for chest pressure or spreading discomfort, severe breathing difficulty, fainting, stroke signs, a dangerous feeling, irregular heartbeat with other symptoms, heavy bleeding with weakness, a prolonged painful erection, or any symptom that is rapidly worsening. Check with a healthcare professional when milder symptoms keep returning, when there is unexplained postmenopausal bleeding, when pain persists, or when exertion repeatedly brings on pressure, breathlessness, dizziness, palpitations, nausea, or unusual fatigue. There is one more safety warning too important to save only for another video. Medicines used for erectile dysfunction, including sildenafil, tadalafil, and vardenafil, can interact dangerously with nitrate medicines used for chest pain. The combination can cause a serious drop in blood pressure. If chest discomfort begins after an erectile dysfunction medicine has been taken, call emergency services and tell the medical team exactly what was taken and when. Do not take someone else's nitroglycerin. Do not hide the medicine because the subject feels private. That information can change how emergency professionals treat you. And this is where responsible intimacy after 60 really begins. Not with fear. With communication. Tell your partner when something feels wrong. Ask your healthcare professional whether your condition is stable. Ask when it is safe to resume intimacy after a heart attack, procedure, hospital stay, or major medication change. Ask whether any of your prescriptions, over-the-counter medicines, or supplements can affect blood pressure, heart rhythm, alertness, bleeding, dryness, pain, or sexual function. These are ordinary health questions. They deserve ordinary, honest answers. Remember the 7 warnings. Chest pressure, tightness, burning, heaviness, or discomfort that may spread. Breathlessness that feels sudden, severe, or out of proportion. Cold sweating, nausea, dizziness, faintness, or loss of consciousness. A rapid or irregular heartbeat accompanied by pain, weakness, breathlessness, confusion, or near fainting. Sudden changes in the face, arms, speech, vision, balance, or coordination. Unexpected bleeding or sudden, severe, persistent pain. And the symptom that appears with exertion, disappears with rest, and then returns. That final sign is easy to ignore because relief feels reassuring, but sometimes your body is not telling you the problem has vanished. It is giving you another opportunity to listen. Share this video with someone who may be too embarrassed to search for this information themselves. A calm conversation today could prevent a dangerous delay tomorrow. And in the next video, we will examine the medication combinations adults over 60 should never guess about, including the timing mistake that can turn two ordinary prescriptions into a medical emergency. Because the most dangerous pill is not always the strongest one. Sometimes it is the pill that should never have met another medicine.